Hello, everyone. This is question 4 of our 100 clinically oriented anatomy questions. Let's get straight into it. It says a 45-year-old male is treated at the hospital after he fell from his bicycle. Radiographic examination reveals fracture of both the tibia and the fibula. On physical examination, the patient has a foot drop or normal eversion. So there's a figure below that shows that, and here is the patient's leg. So which of the following nerves is most likely injured? Tibial nerve, common fibular nerve, superficial fibular nerve, saphenous nerve, the deep fibular nerve. So let's discuss them one after the other. The first one is the tibial nerve. Okay, before we discuss the options, let's check what the question. Well, let's check the information the question gave us. It says fracture of both tibia and fibula. Okay, now said he has a foot drop or his eversion is normal. So what is foot drop? Foot drop is basically the loss of dorsiflexion. Yes, basically when um, the patient cannot dorsiflex the foot. From the image that we were given, this foot right here, you see it's plantar flexed. The other one is very well okay. Nothing is wrong with the other foot. But this foot right here is plantar flexed and this is foot drop basically. So it will be in this shape. This is foot drop. So the patient cannot dorsiflex and the foot remain plantar flexed. So now let's discuss the options one after the other. The first one is the tibial nerve. The tibial nerve supplies the posterior compartment of the leg, that is the muscles of the posterior compartment of the leg, and the muscles there are the gastrocnemius, the soleus, plantaris, flexor digitorum longus, flexor hallucis longus, and the tibialis posterior, and the popliteus muscle actually, but that doesn't have to do with plantar flexion because it does not reach the ankle joint, of course. So now, did he mention that the patient cannot plantar flex? The patient obviously can plantar flex. From what we have here, the foot is naturally plantar flexed safe, which means the posterior compartment of the leg is not affected, which means the tibial nerve is not the nerve that was injured. Next one is the common fibular nerve. Common fibular nerve bifurcates at the posterior lateral portion of the neck of the fibula into the superficial fibular nerve and the deep fibular nerve, right? Now, the superficial fibular nerve runs laterally on the lateral side of the leg and supplies the muscles of the lateral compartment of the leg. So the muscles of the lateral compartment are just two. That's the fibularis longus and the fibularis brevis muscles, and they both evert the foot. That is the only thing they do. They are evertors of the foot. The fibularis longus and the fibularis brevis, they evert the foot. But then the question told us that the patient has a normal eversion. The patient has a normal eversion, which means the lateral compartment of the leg is still normal. That is, the peroneus longus and the peroneus brevis is not affected, which means the superficial fibular nerve is not affected, which also makes option B wrong. Because the common fibular nerve, if the common fibular nerve is affected, it is going to affect both the superficial fibula and the deep fibular nerve. Since the superficial fibular nerve is not affected, which it means the common fibular nerve was not affected. So the saphenous nerve, option D now. Saphenous nerve is the nerve that branches from the posterior branch of the femoral nerve. It's a cutaneous nerve actually. It doesn't have any motor innervation, and it supplies the skin on the medial side of the leg and the um, medial border of the dorsum of the foot up to the ball of the big toe. That is what it does. It does not give any motor innervation, so which means it is not the correct answer. The correct answer is the deep fibular nerve, right? So the deep fibular nerve supplies the anterior compartment of the leg, and this is the compartment that is responsible for dorsiflexion of the foot and extension of the toes. And from what we can see from this patient, the patient cannot dorsiflex his foot. Is a male, yeah. So the patient cannot dorsiflex his foot, neither extend his toes. So the deep fibular nerve is affected in this case. So the correct answer is the deep fibular nerve, and the other options are wrong. So I believe you understand this, and I'll see you in the next video. Please make sure you like, make sure you comment, make sure you subscribe to my channel so you can get more of these videos. Thank you very much, and I'll see you in the next video.